Welcome to today's Pet Pawcast. I'm your host, Dr. Roberta Westbrook, and you're here with us at the Campus for All Animals, the Houston SPCA. Today, I want to talk to you about a condition that we see in our pets that can sometimes be a little bit scary when we see it for the first time, but hopefully today I can help answer some questions so that if you ever have to experience this, and we hope that you don't, that you might know what to do. And that is seizure conditions in dogs and cats. What to do if your pet has a seizure, how do you know what the next steps are, and what we can do to manage the seizure condition. So if you have questions about seizure disorders in your pets, please let me know. Hopefully I can help answer those questions. And in the meantime, I want to introduce you to our pet of the week. This is Daniela. Is a wonderful 3-month-old mixed breed spayed female. She's so sweet. You know, Daniela came to us off of our 24-hour ambulance, and she had a serious injury in her rear leg, an irreparable injury. And our veterinary staff amputated this limb, but Daniela is doing wonderful, and we expect her to live a long, healthy life. So please come on down and meet Daniela and all of the other dogs and cats and puppies and kittens and rabbits that we have available for adoption. We would love to see you in our adoption center every day from 11 a.m. to 6 p.m. So happy holidays, and we hope to see you soon. Now, let's talk a little bit about seizure disorders in dogs and cats. What questions can I start off by answering?
All right, so what are the difference between like a seizure or my dog just like shaking a lot?
That's a great question. If you're a first-time pet owner or you've never seen a seizure in a pet, it can be hard to differentiate when your pet may be having a seizure versus when it may be a normal shivering or tremor related to something else. So typically when pets have seizures, what happens is they usually appear to be unconscious, and there are different levels of seizures. The most common one that we think about when we think about seizures is one called a tonic-clonic seizure. A tonic-clonic seizure is one in which your pet could be laying on his or her side, convulsing. Usually the jaw is chattering, going up and down, and sometimes they may urinate or defecate on themselves during this episode. And this episode can last for several minutes. Generally, your pet will seem unconscious and not respond about with a seizure, although some seizures can be more focal or only occur in certain parts of the body. Now, shivering, on the other hand, let's say you have a pet that appears to be shaking all over the body, but appears to be alert and responding to you. That is more typical of shivering. Shivering also tends to occur in animals that have low levels of body fat or puppies. And of course, when the environmental temperatures are low, such that the body is starting to shiver to create more body heat. But usually a pet that's just shivering is alert and aware of the surroundings and is not related to seizure activity at all.
All right, so are there different types of seizures?
Yes, there are different types of seizures. So, you know, the predominant one that we think about when we think about seizure activity is the tonic-clonic seizure, where the pet is laying over on his or her side. There are full body convulsions. Your pet is unconscious. The jaws may be chattering. They may lose control of their bowels, or maybe even vomit during this episode. That is probably the most common one. But you can have focal seizure activity where it just occurs in the head, where your pet may seem to not be aware of his or her surroundings, and there may be twitching of certain parts of the face or the body. So there are what we call focal seizures that happen in certain parts of the body. So yes, there are different types. If you notice that your pet may be experiencing something where it doesn't seem that they are aware of you or their environment, this may be a sign to take them into the veterinarian. If you can get it on video with your cell phone, this would even be a more wonderful thing to help your veterinarian diagnose your pet more readily.
All right, and how can I help my pet if they're having a seizure, especially one of those like where they seem to be shaking a lot?
Yeah, so it can be scary to see your pet having a seizure, and what you may be tempted to do is to intervene right away to be able to stop the seizure and prevent them from hurting themselves. which you can do that, but we want to make sure that in the process that you do not accidentally get hurt in the process. So there is an acronym that you can remember called STAR if your pet is having a seizure, and it'll help you to recall what to do. The first thing is to make sure that you remove any debris or objects that are around your pet, so that if they have laid over and they are convulsing, that they don't accidentally hurt themselves. So please move any furniture or objects away from your pet. Then the T stands for time and tracking of the episodes. So you want to make sure that you're keeping track of how long the seizure lasts and how frequently the seizures last. A is avoiding your pet's mouth. So again, we want to keep you safe. We don't want you to accidentally get bitten. Sometimes during seizure activity, the mouth is chattering. Please don't put your hand in the mouth. Then you may get an accidental bite. And finally, R is reaching out to your veterinarian. Always make sure that you contact your veterinarian after a seizure, just to make sure that your pet is making a full recovery.
And when should we take them to the vet? I know sometimes, especially when they're seizing, when they don't look okay, then they go back to being normal. When should we take immediate the pet to the vet?
Right. So all seizure activity is abnormal. If your pet has already been diagnosed with a seizure disorder and you are aware of it, maybe it's nothing new for you, then if your pet has a seizure that lasts less than 3 minutes, or if the seizure happens less frequently than 3 in a 24-hour period, then I still would recommend at least calling your veterinarian and letting your veterinarian decide whether or not you should bring your pet in. But if the seizure disorder is such that you've seen seizures in your pet before and you know how to handle it, it may not be necessary to take your pet right in. But if you're noticing that the seizure is lasting longer than 3 minutes, it's approaching 3, 4, 5 minutes, or your pet has more than 3 seizures in a 24-hour period, these are emergent conditions. I would take your pet right in to make sure that we can get those seizures under control.
All right, and what are the different causes? I know obviously it depends on the type of seizure.
Yeah, absolutely. There are lots of different potential causes for seizure activity. One of the most common ones is actually what we call idiopathic epilepsy. Idiopathic epilepsy is a seizure condition where we don't know what causes the seizure disorder. Idiopathic means we don't know. And this can occur in both dogs and cats, where they have sometimes infrequent seizures that are maybe once every couple of months, or sometimes pets with idiopathic epilepsy have frequent seizures where they're several every month. But other things that can cause seizure disorders are toxicities, things that your pet gets into, toxic substances that can cause seizures, liver disease can cause some seizures, diabetes, unregulated diabetes can cause some seizures. So there's lots of potential causes. If you're noticing that these things are happening, again, take your pet to the veterinarian. What we'll do is we'll rule out all of the potential causes by doing a physical exam, getting a history from you, doing some blood work, and potentially doing even further diagnostics to figure out what the cause of the seizures might be.
And then what are the treatment options, especially if it's the first, what was it? Idiopathic?
Yeah,
yes, for that
seizure.
one. What can we do once the pet is diagnosed with that?
That's a great question. So if your pet has now had a seizure for maybe the first time, what do we typically do about it, and what can you expect your veterinarian to do about it? As a veterinarian, if I have a patient coming to me who has had a seizure for the first time, we generally start with trying to figure out whether there was a cause. And as I mentioned, getting a good history from you about what happened around the seizure. Was there any inciting event? Was there any toxic substance involved? Getting information about the age and pre-existing health conditions. And then maybe running some blood work to try to determine the health of the organs, the liver, the kidneys. Are there any signs of infection? Now, once we do all of that and we try to determine whether or not we have a cause, then treatment is a couple of things that we can do. Usually in patients that have not had very frequent seizures or only had one seizure, we may not put them on any long-term medication, because sometimes seizures are very infrequent and we don't want to start your pet on seizure medication right away if they don't need it. We typically only start medication if your pet is having more than 2 seizures a month. More than 2 seizures a month might warrant medication, and so your veterinarian will do all of this evaluation and decide which medication is best for your pet. Once your pet is on medication, usually the medication is lifelong, but in some cases, the medication can be weaned down or weaned off depending on the cause. But there are several different types of oral medication that we can give to your pet to help prevent future seizure activity.
And then when does it get, upgraded to epilepsy? Or do all dogs who have seizures have epilepsy, or is there a difference?
Yes, so epilepsy is just the term of the seizure disorder. Idiopathic epilepsy just means that we don't know what causes it, but there are other types of seizure disorders that we know what causes it. Maybe your pet gets seizures related to another condition, related to a brain tumor, or related to an endocrine disorder. So certainly there are other causes for seizure activity. And again, it depends on the cause, what we may call that.
And are there any seizures specifically in cats?
Cats have been known to have seizures that are related to stimulation from sounds. It's called Feline Audiogenic response syndrome, and so seizures. And so what can happen is, oftentimes when cats get older, sometimes they lose their hearing. And as they lose their hearing, really loud noises or startling noises can actually stimulate a hyperactivity in the brain that can lead to seizures. And so although this is not super common, it can happen in older cats, generally cats that are geriatric and that have some hearing loss. And so in these cats, very loud noises can actually stimulate seizure activity. And so we recommend that if you're noticing that in an older cat, if you have an older cat, 13, 14, 15 years of age or older, and you're suspicious that your cat has hearing loss, and if you've ever noticed any seizure-like activity, you could be looking at this feline audiogenic response seizure disorder.
Thank you so much, Dr. Westbrook. That was so much information. What else do we have going on here at the Houston SPCA?
Well, remember, we want you to come on out to Neiman Marcus in the Galleria and join us for our Homes for the Holidays adoption event. We want to make sure that we can get some wonderful dogs and cats and puppies and kittens into homes this holiday season. So please come on out and visit us at Neiman Marcus on Fridays, Saturdays, and Sundays between now and December 23rd. We'll actually be there all week, the week before December 23rd. So please come on out and see us. We would love to have you, even if it's just to say hi. If you're looking for ways that you can be part of our extended family, we are always looking for volunteers, foster parents, and if it's in your heart, to donate to us at houstonspca.org/donate. We appreciate you joining us every week at the Pet Pawcast. I'm your host, Dr. Roberta Westbrook, and we'll see you next week. Happy holidays.